Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. We've seen the rapid progression of the case count of the novel coronavirus that's been now labeled as COVID-19. And the obvious question that arises is the preparation level in our society and our government for a potential rapid expansion in the case count. We've seen the reports out most recently from Washington State where the death count, unfortunately, amongst our friends and neighbours to the south is now up to 10. They've recorded a total of 28 confirmed cases, but it's widely known in the United States the testing program was far too slow to get going, and the actual case count in Washington State could be much higher. That will become clear in the weeks to come, but the question for the Minister of Health is, can he tell us what the plan is in British Columbia in the event that our case count rapidly goes into the thousands?
Minister of Health.
Thank you, Honourable Speaker. First of all, I want to acknowledge the role played by all members of the House in supporting public health during this time. Particularly, I want to acknowledge the role of the member for Kelowna Lake Country, member the Green Party health critic and House Leader for their role, and the Leader of the Opposition and many others who have spoken out publicly against fear and in favor of science and public health responses. I think that's important. We are stronger together, and I want to express that appreciation right on. The Leader of the Opposition will know that because of preparations and our excellent record in dealing with issues such as SARS in the past, the BC Centre for Disease Control and our Provincial Health Officer, Dr. Bonnie Henry, and my Deputy Ministers, Stephen Brown, have acted from the beginning ahead of many other jurisdictions. For example, we have been taking action from the beginning before there was even a case identified in British Columbia to test people. So we've tested now, and we had tested as of the last time we announced, which was Friday, the numbers, 1,425 samples and 1,012 people. This was significantly more testing, more than twice as much that had taken place in the entire United States of America. This is our plan, which is to contain, and if not to contain, to slow down the growth of the virus here in British Columbia, and we are continued to energetically pursue that plan. But clearly, we will need to prepare for other plans. We do have in British Columbia a pandemic response plan, which has been updated and which we'll be briefing all parties in the legislature before we go home for the spring break, which is going to help respond to further developments of COVID-19 in British Columbia. I think it's important that we continue to support our institutions and support one another in these times. And if I may be allowed one last thing to say, everyone needs to wash their hands regularly. This is important. And again, it's something that all members of the House have been communicating, and I'm very, very appreciative of that, of not touching our face, of when you're sick, stay home from school, from work, and especially from visiting friends and loved ones in long-term care and in hospital.
Leader of the Official Opposition on a supplemental.
Well, thank you to the Minister of Health for that outline, but I think the question is actually more pointed. He has set an example for all of us in practical, personal terms about cleanliness and hygiene, and we thank him for that advice. The BC Centres for Disease Control is remarkably well ahead of the U.S. Centres for Disease Control in test capacity and surveillance systems for new cases. But the question remains, in the event that our case count goes, sadly, from half a dozen to 5,000, what will be the next step after the initial containment phase, once we've now passed this point of saying perhaps people arriving from Iran and parts of China should self-quarantine? What is the next phase in the unfortunate event that the events in Washington State carry over the border?
Minister of Health.
Thank you. So in January, prior to any cases coming to British Columbia, indeed coming to Canada, we set up an emergency response team co-chaired by Dr. Henry and Mr. Brown. Every health authority now has an emergency operations center specifically devoted to addressing this question, which I think is important because there are challenges at every level. And as we ramp up, we are preparing, of course, for a government-wide response, because this as it develops, will have implications for all parts of BC life, not just the healthcare system. So that work is being done. We intend to fully brief the opposition on that work in the coming days, and the Green Party in the coming 24 hours, so that they're as informed as anybody here in the legislature, so that we can continue to work together to respond adequately to what is a significant international health issue. I want to say finally to our friends in Washington State, and I know that the Leader of the Opposition would agree to that, people in public health in Washington State are working very hard and are doing a very diligent work. It is absolutely tragic that the COVID-19 hit, especially a long-term care home in Washington State, and our hearts go out to all the families affected and to the people working so hard now in Washington State to address this problem.
Member Kelowna Lake Country.
Thank you, Honourable. Thank you, Honourable Speaker, and thank you to the Minister for his answers so far. If we can get some clarity on one point through the Minister. Right now, we are in a containment phase. We are trying to contain this. Hopefully, Washington State is able to do the same, so we don't have to have the impact of people traveling back and forth, because obviously the border is very thin between us and Washington State. But over the last week, we heard the Federal Health Minister, Patty Hajdu, recommend that Canadians stock up with enough supplies for a week or so in case their family member contracted the coronavirus, and to remain in self-isolation for 14 days. She said it's good to be prepared because things can change quickly. Canada's Chief Public Health Officer, Dr. Theresa Tam, echoed that message on Thursday in a tweet urging Canadians to keep extra food and medication on hand. And we've seen the run on things at our stores. Just would like to get some clarity from the government and the Minister. What can we do to ensure that British Columbians get the right message today, since we're still in the containment phase?
Minister of Health.
Again, thank you to the member for his question. I think people in British Columbia, we have these preparations now. Many of us live in earthquake zones, and so we are expected and do have preparations in our house for those conditions now. I think the key in this time is to be prudent. I don't think there's any need to hoard goods. I don't think there's any need to hoard goods. But just like if someone in your home was sick with the flu or anything else, it's important to have food and medication available, especially if you are in one of the categories that has a more serious impact of COVID-19 and indeed of influenza. People, for example, with chronic diseases, people who are more elderly, be more prepared for what might happen. That is true in all circumstances, but I think it's really important that we understand that we are, so far in British Columbia, the risk is low and continues to be low, and that we continue to support one another in these times. And one of the things that I admire most about what's happened, for example, in the Chinese Canadian community, and members, including the Leader of the Opposition, have spoken of this, is the willingness of people to help each other, especially in self-isolation. There are groups that spontaneously were created to support one another. This is true, I know, in the Iranian Canadian community as well, which has suffered some now and significantly from the outbreak in British Columbia. So I think it speaks well, and I want to express my appreciation to the people of BC for their response to date. And I think we have to continue to be prudent when we make decisions to travel, to be prepared, but to be serene in our approach so that we support one another when we need to be supported.
Member Kelowna Lake Country on a supplemental.
Thank you, Honourable Speaker. And I bring up the question because not only is the federal government saying one thing, we got leaders from across the country saying all kinds of things. We have all kinds of experts with differences of opinion. You look at Christine Elliott, the Health Minister for Ontario, said that she believes stockpiling is unnecessary and people should continue to go about their lives while being cautious. So it's very similar to what the Minister of Health for BC has said. So obviously juxtaposed to what the Canadian Health Minister has said, people have to use their common sense. Given the current situation, I think is probably the best thing. So to the Minister, and I only have one more question on this, so I'll save some of these other ones for hopefully never, because the virus will go away. But what preparations are the regional health authorities taking to help identify any outbreaks in their local areas, in particular in the Northern Regional Health Authority? I'm hearing stories of people who want to get tested are facing a gauntlet of barriers to get the testing done because they believe they have they have the virus. So if the minister could outline what people can do across British Columbia, especially up in the north, who are farther away from services than people down in the lower mainland, to ensure that we manage this outbreak and contain this outbreak as much as possible so it doesn't become a goal of stopping the spread versus stopping the outbreak itself.
Minister of Health.
Thank you very much. All of the regional health authorities have emergency operations centers now. People in all of the regional health authorities are being tested, and the threshold for tests is lower than in other jurisdictions, but there is a threshold. And we believe that medical professionals are making the right decisions about when people should be tested and how they should be tested. In the last couple of weeks, we've changed our testing regimen so that people that are tested for influenza are also tested for COVID-19. I think that's important, and we are preparing in every single health authority. As you know, 2 health authorities to date have no cases of COVID-19. One of those is the Northern Health Authority, and we hope that continues, and the other is Island Health. But all of our health authorities are preparing equally and fully involved, including the First Nations Health Authority, whose activities are fully integrated with ours. With respect to the Government of Canada, I would say this, that they have been working very hard and in touch with us on a regular basis. The Minister of Finance, Federal Minister of Finance, Mr. Morneau, met with provincial finance ministers on some aspects of this issue today and other issues. The Federal Health Minister has consistently reached out and done that. And what we're trying to be is, I think, supportive of this. There will be lots of occasions to discuss what each of us might say or do better later, but right now we're working closely with the federal government, with the Washington state government and other jurisdictions. If there's anything about it, including the 7 cases that came from travel to Iran, tells us is that this is an evolving situation and that what happens in one place in the world can profoundly affect us here.
Leader, third party.
Thank you, Mr. Speaker. Last week, the BC government took control of yet another seniors' home owned by Retirement Concepts. They're forced to do this because of neglect of seniors. This is the 4th Retirement Concepts facility that authorities have taken over, and there are serious concerns about others. One family just filed a class action lawsuit against another Retirement Concepts facility, citing negligence, emotional and physical injuries, and wrongful death. Retirement Concepts is the largest provider of long-term care in British Columbia, and it's owned by a state-backed Chinese insurance company. Foreign-owned, for-profit company is repeatedly providing wholly inadequate care to our seniors. We are seeing a clear pattern here, Mr. Speaker. It's not enough to intervene in just the most egregious cases or to react to whistleblowers. It seems that for-profit care homes are allowed to repeatedly put profit margins ahead of care. My question is to the Minister of Health. Beyond simply responding to these situations when they come to light, how is the Minister holding this company accountable and ensuring that our elders are not facing inadequate care and neglect?
Minister of Health.
Thank you very much, Honourable Speaker. Indeed, the situation at Retirement Concepts is a serious situation, but I want to put this very much in context. What has happened at Retirement Concepts in Comox, in Nanaimo, in Victoria, and now in Summerland is a serious situation that comes through a very formal process led by medical officers of health. That process and taking over a facility has happened 7 times since 1990. 6 of those are by Retirement Concepts. It's very important not to suggest that other care providers are in the same boat. This is, in this case, a Retirement Concepts problem, and we need to address it, and they need to address it. Last week, they were called to a meeting, including the new parent company called Daja, that was called to a meeting with the Deputy Minister of Health. We've clearly laid out our expectations that this situation cannot continue. Our administrators are doing, I think, an excellent job in bringing these facilities up to standard, and I think we have to continue to do that work. It is unacceptable that the Government of British Columbia is running 511 of Retirement Concepts, 1,641 beds. That's 31% of their beds. It is not good enough, and we are going to continue to take action until they're brought up to standard.
Leader, third party on a supplemental.
Yeah, thank you, Mr. Speaker. And to be very clear, This question is about retirement concepts and retirement concepts alone. And I'm glad to hear the response from the minister. I'm glad to hear that his staff is taking action. And I'm really concerned about the situation that exists. There are still a number of rooms that are controlled by this company. And, I think that the concern continues to arise in knowing that there are seniors that are still under the care of this company. The minister said that whenever there are, quote, this was a few months ago, whenever there are changes in ownership in care homes, we have to review to see if there are changes required, end quote. And as the minister just noted, that the former company Anbang has been restructured, and now the company that controls retirement concepts is under a new state-backed insurance group. So could be argued that these are significant changes in ownership. So my question is to the Minister of Health. Will the government take immediate steps to take control of the remainder of the retirement concepts homes to ensure that all seniors can rely on getting the care that they need in our province?
Minister of Health.
Well, the takeover of retirement concepts occurred in 2016. The review of such takeovers is made by Investment Canada. Concerns were expressed certainly by me and other British Columbians about that takeover at that time, but the federal government approved the takeover. I don't want anyone at Retirement Concepts or anyone else to think that people are going to take this responsibility away from them. They have the responsibility to provide care. We have the responsibility to regulate, and we will. And I think it's an important consideration here. The company in question, and it is why in this case, after Comox and after Nanaimo and after Victoria and now after Summerland, we contacted and have met and will continue to meet not just with Retirement Concepts as a company or the operating company, which are the old owners, by the way, but the holding company to make sure that everybody is held accountable here. Because seniors are in care right now. They deserve our support, and they will have it.
Member Prince George Valemount.
Thank you, Mr. Speaker. Well, last fall, Gordon Bowman of Marpole Physiotherapy Clinic came here to the legislature because he was worried about the significant pressure on small businesses that were caused by dramatically increased property taxes. Here's what the Minister of Housing said to Gordon and the other businesses that were here in the legislature that day, and I quote, "I want to say to all of the business owners that are here, we have been listening. We are taking action, and we will be ready for the 2020 tax year." End quote. But the minister hasn't delivered. Can she explain to Gordon why she has not followed through on the promise she made to them in the legislature that day?
Minister of Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. Well, my words are true today, as they were back then. Small businesses, nonprofits, and arts and cultural organizations have been hurting for a significant amount of time, and we vowed to take action, and we did. We worked with a number of local governments in the Metro region to look at what a permanent fix would look like, and in May, we were presented with a range of ideas. We explored them over the summer, Honourable Speaker, to take a look at what would work for 2020. And in looking at those ideas that are absolutely worthwhile exploring and doing some policy work on, it came really clear to us, Honourable Speaker, that it wouldn't work for 2020. There was still a significant amount of work that needed to be done. So we brought in an interim program that would provide the relief that those businesses are desperately needing, Honourable Speaker.
Member Prince George Valemount on a supplemental.
Well, thank you very much. And the minister knows full well what the reaction to the so-called action that she took has been. In fact, this minister made a promise. She made a promise to Gordon and to other small business owners across the Lower Mainland. She said they would get relief this year, and she simply hasn't delivered. And it's not the opposition, just the members on this side of the House that are saying that. It is mayors from across the Lower Mainland. In fact, she knows that 11 mayors have written to this minister this week and to tell her that her plan is simply unworkable. Here's what Coquitlam Mayor Richard Stewart says, and I quote, "It's not that we're not going to do it, it's that we just can't," end quote. Will the minister admit that her plan is a mistake and that it doesn't work for anyone?
Minister of Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. Well, it became really clear to us that doing nothing or doing something was really the choice that was before us, Honourable Speaker. And so we did do something for 2020. We brought in some legislation that, of course, will be a work for municipalities. In fact, Honourable Speaker, in developing the interim solution, we were working with municipalities. They were helping to give us some feedback about how to best proceed. We made sure that we were hearing their concerns. In fact, Honourable Speaker, some of the feedback they gave to us that having a March 31st deadline to pass this a bylaw was not reasonable, so we changed it based on their feedback. Honourable Speaker, staff have already been in contact with a number of municipalities interested in using this tool, and Honourable Speaker, there is work for municipalities. I understand that. I absolutely understand that, and we're there to support them, Honourable Speaker. We have staff committed to working with them. We have BC Assessment available to generate the kind of data that they need in order to make the decision. We've given them advance notice of this legislation. This is an opportunity for municipalities to work with the provincial government in order, again, to give relief to the businesses and to the nonprofits in their communities. It has been an issue for well over a decade, Honourable Speaker, and I'm very proud of the fact that we got to work right away and we're continuing to deliver for those businesses and those nonprofits.
Member North Vancouver Seymour.
Thank you, Mr. Speaker. This issue is just another NDP broken promise. Also sitting in the gallery to hear directly from the minister last fall, right here in the legislature, was Dr. Gianni Pisano. He's the owner of Granville Dental Wellness Group. And he was reeling from a 60% increase in his taxes in just 3 years. The minister told Dr. Pisano, and I quote the minister, "We've heard you loud and clear, and there will be a tax fix for the 2020 tax year," unquote. What does the minister say now to Dr. Pisano after she has failed to provide any of the promised assistance?
Minister of Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. Well, I have to say that we passed third reading of a bill that I am sure will receive royal assent very shortly. That's what I have to say. The other thing I have to say is that municipalities now have a tool that they can
Members. Members, we shall hear the response. Thank you.
Thank you very much, Mr. Speaker. Again, it will receive royal assent shortly, and there will be law. It will be an opportunity for local governments to deliver with us, with this tool, to the businesses in their communities. Because you know what, Honourable Speaker? Local governments have been saying for some time that these businesses are stretched, that they're challenged. They know their communities really well. They know which businesses need it. And now they have the ability to identify those businesses. They have the ability to identify those cultural groups so that they can get to work, so that we can continue to work together to deliver for the people of this province, for the business people and the nonprofits in the arts and cultural sector, because they deserve that, Honourable Speaker.
Member North Vancouver Seymour.
Thank you, Mr. Speaker. This is just part of the pattern of the NDP. They're just not listening to the experts. There are 10 Metro mayors, 10 Metro mayors, including the City of North Vancouver, plus the UBCM president, who have rejected her plan, including the mayor of her own community, the mayor of Coquitlam. And I quote, "We have some small businesses that are really hurting, and I would do anything to help them. But this is really, really unworkable." That's what the mayor of Coquitlam said about this minister's bill. Why won't this minister adopt our split assessment bill, which is exactly what the mayors want?
Minister of Municipal Affairs and Housing.
Thank you very much, Mr. Speaker. Well, the mayor's proposal is on the table for a permanent fix. It is. We are considering it. But like I said, Honourable Speaker, When it was presented to us in May, we looked at it over the summer, and the analysis demonstrated that it wouldn't be available for 2020. So, Honourable Speaker, that left us with a choice. Continue to do the work, the important work, and we're committed to continuing to do that. But what it meant, Honourable Speaker, is that it would not be ready for 2020. So we made the commitment, Honourable Speaker, to do both at the same time, because we know how to do that, Honourable Speaker. We can work on a permanent fix and an interim fix at the same time.
Member Kamloops South Thompson.
Thank you, Mr. Speaker. Well, the problem is the mayors of Metro Vancouver sent a letter to the minister just the other day, and in it, 10 Metro mayors plus the UBCM president say very, very clearly that the solution the minister has brought forward is unworkable, and these municipalities have no intentions whatsoever of using it. That's the bottom line, Mr. Speaker. And in fact, in 2.5 years, the NDP have perfected the art of putting together reviews and consultations, only to not then follow the recommendations that flow from them. How did the Caribou file go? How did the Caribou file go? Not very well.
Members, we shall hear the question. Thank you.
They did it with the Caribou file. They did it with the implementation of the employer's health tax. And now they're doing it again, Mr. Speaker. They're doing it again here by refusing to implement the proposed solution, the priority solution of the Intergovernmental Working Group and the Metro mayors in Vancouver. The mayors want a split assessment classification. In their letter, they actually say, and I quote, struggling businesses and organizations will end up paying higher taxes, end quote. That's in reference to the minister's solution. So my question to the minister is this: will she take the advice of the Metro mayors, scrap her plan, and bring forward a solution that embodies what they've been asking for all along, and that's split assessment classification?
Minister of Municipal Affairs and Housing.
Thank you, Honourable Speaker. It's amazing that they finally are listening to Metro mayors like this. They've never listened to Metro mayors. Wow. All the years that they fought them on investing in transit infrastructure, and they finally are recognizing that they have a role to play in the regional transportation network. Honourable Speaker, I find it actually very enlightening, and I'm thrilled. I'm thrilled to hear that they're finally listening to mayors, because they certainly ignored them when they were on this side of the House, Honourable Speaker. In fact, Honourable Speaker, we've been working with the mayors, and we have been working with them on a split assessment tool. And we're going to continue, Honourable Speaker, because that's how we roll. We're going to continue to work with them on the permanent solution. The idea is a worthwhile idea, Honourable Speaker, of the split assessment. It would be impossible, Honourable Speaker, it would be impossible to implement it in time for 2020. This was... And so, Honourable Speaker, we developed an interim solution. It's a solution that I do know and I do appreciate is going to take a bit of work for local governments. We've drafted a model bylaw for them. We have BC Assessment at the ready to generate the data that they need, because we know that that's important in terms of the decision making that they have to do. BC Assessment is certainly, answering any calls that they have. They're answering questions that they have about how to move forward. We're also, Honourable Speaker, we put together a whole handbook on how to use this interim solution. It's a real opportunity for local governments and the provincial government to work together to make sure that businesses and nonprofits and art and cultural organizations have the relief that they need.
Member Kamloops South Thompson on a supplemental.
Thank you, Mr. Speaker. Well, the minister looked small businesses in the eyes last year. She looked the local governments in the eyes, and she said that she would bring forward a solution. And you know what, Mr. Speaker? She has failed those local governments and failed those small businesses. The letter, which by the way is dated February 27, so literally just a few days ago, says, and I quote, "While the interim solution put forward by the province may satisfy the desire to put a mechanism in place for the 2020 tax year, the undersigned mayors do not support the interim permissive property tax exemption legislation. Further, we respectfully request that the province continue to work with the Intergovernmental Working Group on implementing split assessment through a new commercial subclass." End quote. Mr. Speaker, because this minister has failed to act, countless small businesses have had to close their doors across Metro Vancouver. And sadly, more are making that painful decision as we speak. After 35 years in business, Bishop's Restaurant in Vancouver just announced that it's closing soon. Why? Because of soaring costs, including property taxes above their heads. Owner and legendary chef John Bishop says, and I quote, "I don't want to retire, but I don't want to get to the point where I would have to declare bankruptcy." End quote. So the question is this, Mr. Speaker. If an entrepreneur like John Bishop, who has worked his tail off for 35 years to build a renowned restaurant in Vancouver from scratch, can't make it due to the skyrocketing taxes above his head, who the heck does the minister think has a fighting chance to start and grow a business in Metro Vancouver?
Minister, Municipal Affairs and Housing.
Thank you. Thank you very much, Mr. Speaker. My father is a small business owner, Honourable Speaker, and I do understand how tough things can be for small businesses and for the families that are supported by the small business. And I do understand, Honourable Speaker, the hardships of being under a triple net lease and having the burden of skyrocketing property taxes. But I also need to remind all the members of this House that this has been going on for well over 10 years. The CFIB identified it and said that no government has ever paid attention to it. But, Honourable Speaker, our government paid attention. Our government heard. And as I have mentioned before to previous questions by the members opposite, I explained how we work together with local government.
Members, we shall hear the response. Thank you.
It seems that they have lots to say, Honourable Speaker, but their time at the microphone is over. Honourable Speaker, I've explained in this House how it came to be that we needed to do the interim solution in order to have something available for those businesses that have been struggling. Because, Honourable Speaker, this isn't about the members opposite. And it's not about us. And it's not about local governments, Honourable Speaker. They continue to be very chippy. I think I'll just sit down because clearly I can't even hear myself speak, Honourable Speaker.
The bill ends question period.